Everyone says I use my ADHD as an excuse when I say I have a hard time focusing. It really pisses me off that people don't understand.
My ADHD is so bad that I have to close my eyes when I'm on the phone. I won't pay attention to the person otherwise. Literally everything in front of me is a distraction.
I hate having ADHD. It's like my mind is running in 10 different directions.
I think the main reason I've never dated is because of my ADHD. I can't sit still for more than 10 seconds.
I have ADHD, and nobody knows because I don't want it to be an excuse.
I just started college. My ADHD is awful. I think I'm going to fail.
I really want to join the military, but I don't think I can make it without my ADHD medication.
For the first time in my life, I'm taking meds to help regulate my ADHD. It's helping, but I don't like how my personality is different.
I have ADHD and can never pay attention, and it's kind of putting my friends and family on edge.
I wish I could turn my ADHD off. I've had to read whole chapters over again and restart movies because I was thinking about something else.
I joke with people about having ADHD when I act dumb, but I secretly do have it, and it makes my life a living hell.
When I got diagnosed with ADHD when I was younger, people told me I would not amount to much. I proved them all wrong.
What does Michael Phelps, the most decorated Olympian in history, have in common with President Bill Clinton and the actor Justin Timberlake? That's right, they were all diagnosed with Attention Deficit Hyperactivity Disorder, ADHD. According to the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM, ADHD is both a psychiatric and neurobehavioral disorder. This disorder is characterized by significant difficulties with inattention, hyperactivity, and/or impulsivity. Both boys and girls can have ADHD, although it is 3 times more common in boys.
Let's play a game. Find the kid with ADHD. This one's a no-brainer, right? Well, you know what I mean. But did you notice the girl brain staring out the window? How about the one still working on her test long after everyone else is finished? If you didn't, you're not alone. Boys are diagnosed with ADHD 3 to 4 times as often as girls are, even though research is starting to show that girls are just as likely to have it. In fact, some experts believe that boys are being overdiagnosed, while girls tend to be underdiagnosed. Why is that? The simple answer? It's complicated. I did a ton of research on the issue, and I found 5 main reasons for this. 1. Stereotypes. Boys tend to have the hyperactivity form of ADHD, which is what we tend to think of when we think of ADHD. Since most research, literature, pop culture focuses primarily on how ADHD expresses itself in males, most people are more familiar with what ADHD looks like in males. The less girls fit into that stereotype, the less likely it is that they'll be recognized and diagnosed. 2. The squeaky wheel gets the grease. Boys with ADHD tend to cause more trouble, so parents and teachers are more likely to look for a solution. Girls tend to have the inattentive form of ADHD. On progress reports, they're the well-behaved, bright students that just need to try harder. Even the girls who are hyperactive tend to try to work harder to be good and fit in than their male counterparts do, probably due to societal pressure. 3. Clinical bias. Even if a girl does stand out enough to be referred to a mental health professional, she's less likely to be diagnosed with ADHD than a boy is, even if she has the exact same symptoms. 4. Girls are more mature. Actually, girls just mature faster than boys do. There is a definite correlation between maturity and likelihood of diagnosis. Studies have shown that children young for their grade level are more likely to be recognized and diagnosed. Since girls tend to mature faster than boys, they're more likely to be missed. 5. ADHD comes with friends, and not the good kind. 40% of those with ADHD also have a learning disability, such as dyslexia, and 75 to 80% of kids with ADHD will develop a second or even third psychiatric condition at some point in their lives, which makes things really messy and hard to diagnose even for experts. That's true for both genders, but girls are 3 times more likely than boys are to be treated for depression before they're ever diagnosed with ADHD. So, despite what pop culture would have us believe, ADHD is not a one-size-fits-all stereotype that's easy to spot. So, as teachers, coaches, parents, friends, is, how do we know what to look for? Well, it helps to understand what ADHD usually looks like in girls and how that differs from what it looks like in boys. Before I get started, A, I'm not a doctor, you probably know that by now, and B, these are generalizations. Not every boy or girl will behave this way, but they tend to. Boys get in trouble a lot at school and work. Girls tend to have more difficulty in social relationships and at home. Boys are usually more physically aggressive, shoving, hitting, kicking. Girls are usually more verbally aggressive. Boys' symptoms are more external. Girls' symptoms are more internal. Boys often interrupt while other people are talking. Girls space out while other people are talking. What were you saying 5 minutes ago? Boys externalize their frustrations. Girls tend to turn pain and anger inward. Boys are more likely to have behavioral issues. Girls are more likely to suffer from low self-esteem, anxiety, and depression. Remember, these are generalizations. This is not going to be true for everybody, and there's going to be exceptions. In fact, boys with the inattentive form of ADHD also tend to get overlooked. And even boys with hyperactivity can easily be dismissed as just boys being boys. In both boys and girls, it's important to recognize and treat ADHD as soon as possible. Early treatment can not only help manage symptoms now, but help prevent other disorders from developing in the future.
Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Pete, Florida. I want to talk a little bit about the causes of ADD or ADHD in children. Researchers and mental health and medical professionals are still really not exactly sure why some people develop ADD or ADHD. We're starting to see a genetic link, meaning there might be more prone in some families. So there might be a tendency to inherit, a gene or a genetic tendency to have attention deficit problems. But we do know that ADHD is caused by changes in the brain chemistry or in chemicals in the brain. And we know that neurotransmitters are probably responsible for most of that chemical reaction. And researchers have isolated probably dopamine, maybe serotonin, maybe some other chemicals, but we know that dopamine is responsible for some attention and some attention regularities or regulation areas of the brain. So some of the causes of ADD might be chemical, some of them might be inherited, and if we can isolate that further, we might find better medications or better ways to prevent ADD from actually occurring. But without actually getting inside a brain before and after, we won't know for sure. So we're going to have to try to do a lot of what's called, rule out by exclusion, find things that really aren't causing it to maybe pinpoint more towards some of the things that actually are causing it. So in summary, we want to look at genetics, probably play a role. Most people with ADD probably inherit the tendency or the predisposition toward that, and neurotransmitters, specifically dopamine, might be responsible for some of the attention regularity problems that people have with ADD. My name's John Bosworth, and we're looking at some of the possible causes of ADHD in children.
Hi, Mom. Good to see you again.
There is no blood test or brain scan for ADHD. Instead, the doctor talks to the patient, the parents, and if possible, teachers to make a diagnosis.
We take in many factors. We certainly observe the child and examine the child. We would like to have psychological and educational testing of the child. We would like to have information from the parents, information from the medical history, and also information from the school to give us an idea of how the child is behaving and how they're responding in school.
Teachers are very often the first to notice that a child is inattentive, distractible, etc. Teachers cannot diagnose ADHD, but they'll bring the problem to the attention of the
intellectual disabilities. Now, if you have a student like this in your class, I will let you know that it is going to be very hard. And what we need to realize is that their cognitive ability, where they are in their brain, isn't going to match how old they are. And so when you have a student who is 10 years old, but is thinking on age 5, you will need to address them as if he was age 5. You will have to repeat a lot. That's one of the best strategies. Repeat. Keep things very, very simple, and you will need to show him or her everything you need to do. And then when he forgets, because he will, you will have to show him again. Okay?